Welcome to Children's Mercy's SMART Asthma class. In this class, we discuss what asthma is, what SMART stands for, the medications used to treat asthma, triggers that make asthma symptoms worse, how to use a SMART asthma action plan, how to use a spacer, and how to keep asthma well controlled at home. So what is asthma? Asthma is a lung disease. The airways in the lungs get very small. It is hard for air to move through very small airways. This makes it hard to breathe. Asthma is often passed down through the family. Some of the common signs and symptoms of asthma are cough, wheeze, tight chest, and fast breathing. Young children may also complain of a sore belly. This is because when breathing hard and fast, the body uses the muscles in the belly to help get air in and out. It is important to check asthma control at home. Well-controlled asthma can be broken down into 4 goals. First, able to play without signs or symptoms. Second, having asthma signs and symptoms during the day 2 or less times a week. Third, having asthma signs and symptoms at night 2 or less times per month. And fourth, coming into the hospital or emergency department less than 2 times a year. Note the pattern of using the number 2. This is what we call the rule of 2s. If not meeting one of these goals, see an asthma provider. Asthma is treated in a stepwise approach, and not meeting one of these goals may mean it's time to step up asthma treatment. Staying well controlled for a long period of time may mean it is time to step down asthma treatment. This picture shows the inside of the lungs. Air is breathed through the nose and mouth. The air goes into large airways. Large airways branch into smaller airways, and there are muscle bands that wrap around the airways. So what causes asthma signs and symptoms? Asthma airways are sensitive or easily bothered. In a normal airway, muscles around the airway are relaxed and wide open. During an asthma episode, muscles squeeze around the airway when they have been bothered by a trigger. There is swelling and inflammation inside the airway and more mucus, which makes the airway much smaller than before. This is what causes asthma signs and symptoms such as cough, wheeze, tight chest, and fast breathing. SMART stands for Single Maintenance and Reliever Therapy. SMART inhalers have a quick reliever medicine and a controller medicine in one inhaler. The controller medicine helps to control the swelling and mucus in the airways. It also helps to prevent asthma signs and symptoms. The quick reliever medicine helps to relax the muscle squeezing on the outside of the airways. It works fast to stop asthma signs and symptoms. Here are some important things to know about SMART inhalers. There may be times when a SMART inhaler is used more often. An asthma doctor or provider will help decide when. These times can be when a child has a cold or virus or with weather changes. SMART inhalers should always be used with a spacer. Check the counter on the SMART inhaler often. Children should always rinse their mouth out after using their SMART inhaler. Some providers may give an albuterol inhaler to use at school or in emergencies, such as if a SMART inhaler runs out. If a child does not have their SMART inhaler, they may use their albuterol inhaler for symptoms. Parents or guardians will need to call their provider to get another SMART inhaler. Here are 2 frequently asked questions about SMART inhalers. First, my asthma bothers me when I exercise. Will my SMART inhaler work for that? The answer is yes. SMART inhalers can be used 10 to 15 minutes before exercise to keep asthma symptoms from starting. Next, I can only refill my SMART inhaler once a month. What if I use up my inhaler before I can get a refill? Refill inhalers every month until there are at least 2 inhalers at home. Now there will be extra inhalers for times when it is needed most. Talk to your provider if you do not have at least 2 SMART inhalers or you are running out of medicine. Next, let's talk about the medications that make asthma signs and symptoms better. There are 2 types of medicines that make asthma signs and symptoms better: the SMART inhaler and the emergency medicine. The S.M.A.R.T inhaler has a quick reliever and a controller in one inhaler. It relaxes the muscles around the airway and controls swelling and mucus inside the airways. The emergency medicine brings back control of serious symptoms. There are two options for S.M.A.R.T inhalers. Dulera, which has two medicines called mometasone and formoterol, or Symbicort, which has two medicines called budesonide and formoterol. Both inhalers should be used with a spacer. Some children may need another asthma medicine such as Spiriva, also known as tiotropium, or Montelukast. Both of these medicines help to control asthma symptoms. Emergency medicines are steroids, usually in the form of a pill or liquid, that are taken by mouth and are used to bring back control of serious symptoms. Prednisolone, Orapred, and prednisone are some of the commonly used steroids. Now we will talk about triggers. Triggers are things that can start asthma signs and symptoms. Triggers are not the same for all children with asthma. It is important to find what triggers asthma for each child. Cold or virus. This is the most common asthma trigger. Treat cough and wheeze during a cold with asthma medicines. Wash hands often and stay away from people that are sick. Exercise. Warm up before exercise, cool down after exercise, and use albuterol or a S.M.A.R.T inhaler before exercise as needed. Weather. For cold weather, wear a scarf over the nose and mouth, and for hot weather, use air conditioning. Strong emotions. This can include laughing and crying. Calm the child down and use their quick reliever or S.M.A.R.T inhaler as needed. Mold. Keep a house dry, use exhaust fans, and keep humidity less than 50%. Dust. Wash linens in hot water. Use a vacuum with a HEPA filter for carpets and area rugs at least once a week. Change furnace filters every 2 to 3 months. And wipe dust with a wet cloth. Smoke or vape. It is best to try to quit. Never smoke or vape in the house or a car. Smoke or vape outside and wear a cover-up. Strong smells. Use fragrance-free cleaners and do not use strong-smelling air fresheners or perfumes. Cockroaches. Keep home free of clutter. Do not leave dishes in the sink overnight. Keep the home dry and take out trash every night. Lastly, animals. Keep animals out of the bedroom and off furniture as much as possible, and bathe pets weekly. This picture shows some of the common triggers that can be in a bedroom. Watch out for these in the home because they can make asthma signs and symptoms worse. Take a moment to answer these questions about your home. If you have answered yes to any of these, please contact our environmental health program. This number can also be found in your asthma booklet. This program can help identify the triggers in the home. They can provide a virtual or in-person walkthrough of your home to help find asthma risks, as well as give resources to help you reduce the triggers found in your home. This program is free and by choice only. We will now talk about asthma action plans. If you have an asthma action plan, please follow along. An asthma action plan is a tool to help manage asthma signs and symptoms at home. Keep your asthma action plan where you can find it, such as on the refrigerator, and/or take a picture and keep it on your phone. This can also be sent to school or daycare. Asthma action plans are modeled after stoplights with a green zone, a yellow zone, and a red zone. The green zone is the go zone, or feeling good zone. In the green zone, there are no asthma symptoms. You can play and sleep without symptoms. Your S.M.A.R.T inhaler will be written at the top as well as how often you should take it. Remember to always use a spacer with your S.M.A.R.T inhaler. Some children take their SMART inhaler every day in their green zone, while others only take it when they are sick or have asthma symptoms. Follow what is listed on your asthma action plan. Your green zone may also list other asthma medicines that you should take every day. The yellow zone is your slow down zone. You will move to your yellow zone when you are starting to have asthma signs and symptoms, or your asthma symptoms are worsening. You may also move to your yellow zone if you have the first signs of a cold or virus, such as a sore throat, runny nose, or tummy ache. In your yellow zone, you will continue all medications listed in your green zone, if any. Here, you may start to take your SMART inhaler on a regular basis, take the same amount as you take in your green zone, or increase the amount you take it. Follow what is listed on your asthma action plan. You will also take 2 puffs of your SMART inhaler as needed for asthma symptoms such as cough, wheeze, or a tight chest. There are a maximum number of puffs that you can take of your SMART inhaler each day, either 8 or 12. Your provider will write your maximum number of puffs on your asthma action plan. This amount includes the dose used daily for control of your asthma symptoms. For example, you take 2 puffs of Symbicort in the morning and 2 puffs of Symbicort in the evening to control your asthma symptoms. Your maximum number of puffs per day is 8. You have 4 puffs available to use for asthma symptoms throughout the day. If you need more than the maximum number of puffs listed on your plan, you will need to go to the red zone. If listed on your plan, make an appointment to see your asthma provider if you are in the yellow zone. The red zone is your stop zone. In the red zone, you are finding it hard to breathe, or you have used your SMART inhaler more than the maximum amount of puffs listed on your asthma action plan. If you have your emergency medicine available, take it now. Call your asthma provider or the Children's Mercy Nurse Triage line at 816-234-3188. Go to the ER or call 911 if you are pulling in at the ribs or neck, your lips or fingertips are blue, you are struggling to breathe, or you are very concerned about your breathing. Now we will talk about spacers. You should always use a spacer with your SMART inhalers. Studies have shown that using an inhaler alone leads to most of the medicine ending up in the mouth, throat, stomach, and lungs. Using an inhaler with a spacer allows more of the medicine to be delivered to the lungs. First, we will talk about how to give an inhaler with a spacer and mask. Children under the age of 10 will use the spacer with the mask and will likely need help from a parent or guardian. First, check the dose counter and expiration date on the inhaler before giving the medication. Parents and guardians. You will sit with your child on your lap or in front of you. Shake the inhaler, remove the cap from the inhaler, and place the inhaler into the spacer. Seal the mask over your child's nose and mouth. Push down on the inhaler to release 1 puff into the spacer. Hold the mask on your child's face for 5 to 10 breaths. Remove the mask from their face and wait about 30 seconds. Repeat steps 1 through 6 for each puff. Next, we will talk about how to give the inhaler with a spacer and mouthpiece. Children ages 10 and older will use the inhaler with the spacer and mouthpiece as long as they are able to follow these steps. Children may be able to take their inhaler with the spacer and mouthpiece on their own, but may require help or supervision from a parent or guardian to make sure that they are doing these steps correctly. Check the dose counter and expiration date on the inhalers before giving the medication. First, shake the inhaler. Remove the caps from the inhaler and the spacer. Place the inhaler into the back of the spacer. Take a deep breath and let it out all the way. Seal your lips around the mouthpiece. Push down on the inhaler to release 1 puff into the spacer. Breathe in slowly and deeply through your mouth. Hold your breath for 10 seconds. If the spacer makes a whistle sound, it means you are breathing in too fast. Slow down. Let out your breath, wait about 30 seconds, then repeat steps 1 through 6 for each puff. We recommend spacers are cleaned once a month or when dirty. Some spacers may be cleaned in the dishwasher. Please read the instructions that come with your spacer. To clean by hand, first remove the back piece. Twist the chamber to remove the front piece. Soak all parts in warm water and liquid dish soap. Move gently. Do not scrub the inside of the spacer chamber. Next, rinse and air dry overnight standing up. Do not rub dry. Once dry, fit the front piece on the end of the chamber and twist until locked in place. Center the notch on the back piece with the line on the chamber. Press back piece firmly into place. Priming inhalers. To prime an inhaler means to give it the recommended amount of test sprays to get the inhaler ready for use. Inhalers should be primed when they are brand new, when they are not used in a certain amount of time, or, for some inhalers, when they are dropped. The table on the right shows instructions for each brand of inhaler. This table can be found on page 30 of the S.M.A.R.T asthma booklet. Instructions will also be in the pamphlet that comes with your inhaler refills. Now let's review asthma control again. Children with asthma should be able to play without asthma signs and symptoms. They should have asthma signs and symptoms during the day 2 or less times per week. Have asthma signs and symptoms at night 2 or less times a month, and come into the hospital or emergency department for asthma 2 or less times per year. Check control often and contact your provider if these goals are not being met. Use an asthma diary to track symptoms during each month. Take these to provider appointments to check asthma control. Asthma control tests are another way to check asthma control. Now we will end with a few review questions. You wake up in the night with a cough and a wheeze. What is the first thing that you would do at home? A. Take a drink of water. B. Take the S.M.A.R.T inhaler. Or C. Take an emergency medicine. The answer is B. Take your S.M.A.R.T inhaler. You have the first signs of a cold and you used your S.M.A.R.T inhaler for worsening symptoms. What zone are you in? A. Green. B. Yellow. Or C. Red. The answer is B. Yellow. You have used your maximum dose of your S.M.A.R.T inhaler for the day and you are still having asthma symptoms. What zone should you go to now? A. Green. B. Yellow. Or C. Red. The answer is C. Red. If you are in the hospital, here are some things to know before leaving the hospital. The bedside respiratory therapist will go over your asthma action plan before leaving the hospital. Take home the inhalers and spacer used at this visit. Follow up with your primary care or asthma provider within 1 week of leaving the hospital for refills on your asthma medicines. Continue taking your emergency medicine if instructed by the nurse at discharge. You may not have any doses left to take. Stay in your yellow zone for as long as your plan says, usually 1 to 2 weeks. After that time, you may go back to your green zone and follow the instructions in your green zone. For more asthma information and resources, please visit childrensmercy.org/asthma or call the Children's Mercy Asthma Program at 816-302-3484. Thank you for watching Children's Mercy's S.M.A.R.T Asthma class.